3-month-old Winnie is suffering from pneumonia. She has been at the Kilifi District Hospital now for 2 days, under the watchful eye of Dr. Anne Wariri.
After malaria, pneumonia is the second most common diagnosis made in children aged less than 2 years here at Kilifi District Hospital.
Dr. Anne and the other staff on the paediatric ward must deal with the consequences of pneumococcus infections every day of the year.
Okay, so there's all this here especially. There is definitely something going on. This child has severe pneumonia. It is very likely that the pneumonia this child has been caused by the pneumococcus. This child is receiving intravenous antibiotics and also requires some oxygen.
Antibiotics are the standard and only available treatment for pneumococcal infections. But usually, by the time the antibiotics are given, the infection is well entrenched. The doctors are always trying to catch up.
Some of the children are brought to hospital early in the disease before it becomes severe, but unfortunately there are some who are still brought when the disease has progressed and it becomes quite difficult to treat them, even though they get the adequate antibiotics. There are no preventive measures that are being carried out against the pneumococcus in our setting.
Physiotherapy, if he's to walk, he'll walk on his tiptoes.
Meningitis patients are also vulnerable to the medical community's reliance on antibiotics. Clay Lewis suffered an attack of meningitis 2 years ago. Thanks to antibiotics, he survived, but the damage was already done. He has never fully recovered.
Streptococcus pneumonia is the leading cause of meningitis in children in this area.
See, relative to his age, he's 3.5 years. The head circumference is just that of a 1-year-old.
There are limits to the use of antibiotics, especially if the infection has already progressed and caused complications.
He cannot speak, though he can see and hear. He still controls his neck very poorly, like an infant. He has to be fed by the parents.
Once children develop complications arising from meningitis, this is going to affect them for the rest of their lives.
For those tasked with helping these victims of the pneumococcus, it is difficult to remain unaffected by what they see.
I think I'd describe the feeling that I have as being helpless, because we see these children when they have already developed the disease. All you can do is give them the antibiotics and wait for them to work and see the children day after day. And it's not good. It's not good.
Another statistic is added to the millions of infants worldwide killed by pneumonia this year. Winnie Mwajifweya gave up her struggle for life just 3 hours later.